Good morning. My name is Dr. Rahul Thambi. I am the Chief Consultant of Arthroscopy and Sports Medicine Department in Devi Hospital, Tripunithura. So today I wish to talk to you about a very flourishing and growing department called sports medicine in our country. It's already established very well established in Western countries. So it's much being developed in India. Has already been established in many of the centers in India. So we look forward to making it a big, huge department, including arthroscopic surgeries and sports medicine here. So what I wish to talk to you is about sports medicine. India is very keen on watching sports. The majority of the population watches sports, primarily cricket. Cricket is the most popular sport in India. Apart from cricket, football and other popularity gaining sports are tennis, badminton, archery, athletics, which has all been all-time famous in India. So, besides watching these sports, unfortunately, we also see players getting injured. While in the TV or in the stadiums, they fall onto the pitches getting injured. They hold on to their shoulders, the knees, which looks very unfortunate. We are also very apprehensive that our favorite players will they be coming for the next game, or will they be only available for the next season, which will be a huge setback for that particular team, professional team. What are these common injuries and how do they get treated? So I don't like to much elaborate, but I would like to give a small idea regarding this sports injury. So some of the very common sports injuries which we commonly encounter, or which the surgeons encounter, orthopedic surgeons encounter, are in the shoulder. One is regular dislocation. We can see commonly in football and in cricket, the players getting injured and getting dislocated. The shoulder gets dislocated. The player holds on to his and leaves the field. So what generally happens? And there is a high propensity that the dislocation repeats again and again. So as we see in the shoulder joint, the arm bone articulates with the scapula, the shoulder blade, and there is a labrum which increases the volume. So the labrum gets torn. When the labrum gets torn, there is a regular tendency for the shoulder to get dislocated. So this regular dislocation can increase the chance for arthritis and can even end the career of a very well-known personality, a team player or a celebrity player. So an arthroscopy surgeon, what he does is he tries to repair or the labrum which has the chance for regular dislocation. So this is called arthroscopic labral repair. That means the labrum is repaired using suture angles. Okay. So and the player he or she can very well come to the next season for the games and continue his career. Otherwise, his or career will be under threat. So the next commonly injured ligament structure is the anterior cruciate ligament of the knee. So the ACL is very commonly injured in football, especially the soccer matches. So what we do is actually we can treat the anterior cruciate ligament, reconstruct the anterior cruciate ligament using the person's own tendon. Okay, so we'll drill holes into the thigh bone and the leg bone, shin bone, and we may take a particular tendon. It's called hamstring tendon, semitendinosus or gracilis. Fold it and then use it as a new graft for the replacing it for the damaged ACL, old ACL. So what we do is we drill holes and fix it to the thigh bone and here using screws. And then gradually the physiotherapy starts and he or she will be able to come to his own professional team by the next season, most probably. For cutting sports like football and cricket, we advise a time period of 9 months to 1 year for the graft to incorporate into the bone. Other common injury is the meniscus, which acts as a shock absorber or a cushion within the knee. So the meniscus is also very commonly injured along with the ACL. So the meniscus also we can either debride or repair within the knee. Other common injuries which may not require surgery are the ankle ligament injuries, which is very common. It doesn't need to be for the sports person alone. Even the common people who walks around, who goes for jogging, suddenly sprains his ankle, getting down the stairs. So this also needs to be treated properly. Otherwise, there is a high propensity or high tendency for the ankle to get regularly to get sprained. So this has to be taken into account. So we are just focusing on the sports injury. It just needs to, the sports medicine just need to be focused on sports injuries alone. There are other common injuries which we see it may not be injuries, maybe ailments or complaints which common people say, maybe homemakers at home. Most probably it's the pain around the elbow joint. So what is this actually? It's commonly known as tennis elbow. The pain which is shown on the outer aspect of the elbow. The patient, he or she may point the pain towards elbow. The people who regularly do screwing movements, such as use of machinery, such people experience pain here, and it's a very common thing. Every one of us must have experienced it at one point or the other. It's commonly known as the tennis elbow, where the muscle which helps us to extend the elbow gets inflamed. It's also known as lateral epicondylitis. So the other one is golfer's elbow, which is seen on the inner aspect of elbow. These were seen in commonly in earlier in sports injuries. So like that's why the name was which is, but it's like a misnomer. You must have heard of the famous incident, old incident when Sachin Tendulkar got seriously afflicted with the tennis elbow, lateral epicondylitis, and he had to undergo surgery, which is not commonly done. Since he is a professional player, he had to undergo it. Similarly, so this need not be considered a sports injury, but it's a common ailment. In combination with a very well established physiotherapy team comprising well-trained physiotherapists and we surgeons, we form a team in which we look forward and treat sports injuries very actively. I had the opportunity to visit Barcelona, which is famous for its football club, Barcelona FC, and it's also renowned for most of the sports, very active sports centers which is happening in the city. So I worked with some of the most famous names in sports medicine there, and completed a short-term fellowship, which I consider as a lifetime opportunity.